Hello and welcome to this week's edition of the Huffines Institute's podcast. We are so pleased to be able to share with you a special video that was made here on Texas A&M's campus. And basically we have titled it Everything You Want to Know About the COVID Vaccination But We're Afraid to Ask. Unfortunately, in spite of many people's efforts to this, there's still a lot of folks that are very hesitant to get the COVID vaccination. And over the last several weeks, we've been trying to provide that information to help people decide to get that vaccination so we can all move closer to herd immunity towards for COVID and get back to what we used to remember as normal life. So in an effort to do that, this video was shared with me by our athletics department, and I'd like to acknowledge the athletics department here at Texas A&M and all the speakers on this video for allowing us to put this on our podcast and send it out. I really hope that it will continue to provide more information for you as you decide whether or not to get the vaccine. And on behalf of all of us, we hope that you decide to get the vaccination. Now let me introduce who will be on our special podcast today. This podcast, this video that you will see, is moderated by Dr. J.P. Bramhall. Longtime viewers of our podcast will remember Dr. Bramhall from the several podcast appearances he's made with us, including one last August where he talked about the SEC's efforts and specifically Texas A&M's efforts to get our sports programs back up and rolling. Just as a reminder, he's the team physician. He is the team physician here at Texas A&M, and he's the founder of Central Texas Sports Medicine and Orthopaedics. Also joining him on the panel today is Dr. Shawn Gibbs. Dr. Gibbs is the Dean of the School of Public Health here at Texas A&M and has taken the lead at Texas A&M on so many of our COVID-related issues, as well as being our lead representative at the SEC for COVID infection control processes that are used during all athletic events. Also on the video today is Dr. Marsh. Dr. Marsh is a physician at Central Texas Sports Medicine Orthopaedics and one of our team physicians here. Also on the video is Dr. Sheri Walters, who is the Director of Olympic Sports Athletic Training and Physical Therapy here at Texas A&M University. And also on the video is Mr. Dan Jacobi, who is the Director of Athletic Training here at Texas A&M. So without further ado, I'll turn it over to this video and enjoy, and I hope you get informed.
So I want to welcome everyone to the COVID-19 Vaccine Education Symposium, if you will. Our panelists today are a very well educated over the past year in COVID management and logistics, and hoping to be as safe as we can in keeping you guys on the field and away from this disease. So on our panel today is Dr. Shawn Gibbs, who serves as our Dean of School of Public Health, and he has been our Texas A&M member on the SEC Medical Task Force, which has set the policies and procedures by which we've operated this past season. Also on the panel is Dan Jacobi, who serves as Director of Athletic Training and our head athletic football trainer. Next is Dr. Marsh, who serves as our head women's team physician, and Dr. Sheri Walters, who is our Director of Olympic Sports Athletic Trainer and Physical Therapy. So welcome everyone, and as we go through, I welcome your responses and welcome your expertise on some of the matters we're going to discuss. So Dr. Gibbs, will you lead off for us and just kind of explain what a vaccine is, how it affects our immune system, and some of the types that we're dealing with our COVID?
So essentially what the vaccine does is it introduces a portion of the virus into your body, not a living body. It uses what's called mRNA, which is messenger RNA. So it's just a little fragment of this virus. And what it does is your body recognizes this little fragment and it starts really generating an immune response and generating antibodies so that then later on can protect you. Right now, what we're seeing is that the vaccine doses that we're giving have an efficacy that they can last for about a year or so. The information is still coming on that, but we're confident that it'll last at least a year. It's entirely possible that in the future that you would need booster shots based upon changes within the virus as well.
Do you know when those booster shots might be required, or do we just not know yet, Dr. Gibbs?
We just unfortunately don't know yet. What we're seeing with all of the emergency use authorization approved vaccines here in the United States is that they'll give you at least a year's worth of coverage and probably longer. What I think is very likely to become commonplace in the future is that the booster shots may become integrated into your annual flu vaccinations as well.
Dr. Marsh, can you just kind of tell us some of the side effects that we may encounter as we become vaccinated? And are those side effects a good effect for us, or is that something that we need to be aware of?
Most of the side effects will be similar to what you would see with an annual flu vaccine. So maybe a little bit of arm soreness. Some people experience fever for up to 48 hours, some general kind of malaise and just not feeling well. And it's not that it's making you sick. As Dr. Gibbs just said, we're not introducing viral particles into your body, but it is your immune system ramping up and responding, which is what we want to see. And that being said, if you have a vaccine and don't have any side effects, that doesn't necessarily mean that it's ineffective. It just means that you didn't demonstrate those physical signs. And some people see more with the first shot versus the second shot or vice versa, but it just means that your immune system is doing what it's designed to do.
So we don't have a live virus in the vaccine.
Correct.
So it's safe. Is the vaccine safe?
It is safe. They've done controlled trials on all three of them. And while we don't have years worth of long-term data, we have enough data to say that they are considered to be safe, and the benefits of the vaccine outweigh the risks that go along with potential COVID infection, as well as contracting COVID and spreading it to other people as well. So yes, they are considered to be safe, and they're considered to be highly effective.
So Dr. Gibbs, from a public health standpoint, why should we get the vaccine?
So essentially, the COVID-19 vaccination is an important tool to help us stop this pandemic. And our best chances to getting back to what we knew as normal in 2019 is through vaccination. So the combination of getting vaccinated and following the CDC's recommendations to protect yourself and others will offer the best available protection against COVID-19. Wearing masks and social distancing help reduce your chance of being exposed to the virus or spreading it to others, but these measures aren't enough. All COVID-19 vaccines that are currently available in the United States have shown to be highly effective at preventing COVID-19 infection, reducing hospitalization, and almost essentially eliminating deaths. Based upon what we know about vaccines and other diseases and the early data that we're seeing from the clinical trials, we believe that getting a COVID-19 vaccine may also help you to keep others from getting seriously ill and to prevent you from spreading it to others. Getting vaccinated yourself also protects the people around you by reducing the amount of virus that you potentially would produce even if you were infected and eliminating that spread. Experts across the country continue to conduct more studies about the effect of COVID-19 vaccination on the severity of illness. And what we're seeing routinely is that its ability to keep people from spreading the virus is becoming very clear. One of the big things that I would also say, and you're hearing more about variants, is this is a race against the variants. It's a race against mutation. All viruses will mutate. All viruses will create variants. One of the biggest issues that we've got right now is in human history, it's been a long time since we've had a virus in millions upon millions of people. And as a result, we're already starting to see variants that are being developed. The more people that we can get vaccinated reduces the likelihood of these variants and reduces the likelihood that we get a variant that's far more problematic than the COVID-19 virus that we've been, or sorry, the SARS coronavirus 2 variant that we've been dealing with now.
Appreciate that, Dr. Gibbs, because I think it does emphasize the fact that if we become vaccinated, our chances of spreading the disease, which we're trying to prevent, is very important. So is it also true that with the high effectiveness of all of the three vaccines we're using, it doesn't really matter which brand you get? It's just take the brand that's available to you as soon as you can get vaccinated. Would you agree with that?
I would say as soon as you can get vaccinated, regardless of what brand's out there. We're seeing good efficacy across all three that are currently approved, and we're expecting probably another 2 to be approved over the summer.
Dr. Marsh, do you know if you can still be a carrier even after you've been vaccinated?
We do see some evidence that you can be a carrier, and that's why some of the recommendations are still in place as far as masking and then continuing to distance as much as feasible and use the hand sanitizer. We'll learn more in the coming months, but we do see that it's you can potentially be a carrier even after being vaccinated.
So Dr. Gibbs, do we know when the vaccine will become more readily available?
So right now, anyone 16 years and older here in the state of Texas, and anyone who's an adult across the country can get vaccinated and is eligible to be vaccinated. Here at Texas A&M University, we have a large number of vaccine available. If you go to the Student Health Center website, or if you go to the Brazos County Hub website, you'll be able to schedule an appointment and probably get that appointment within a week or 2 weeks. I don't know when you're watching this, but within the next week or so here, we're going to expect to have about 5,000 new doses of the Pfizer vaccine available through the Student Health Center. The Moderna vaccine is currently available through the Brazos County Hub. And then towards the end of April, we're going to be hopefully moving the Student Health Center over to the Johnson & Johnson or the J&J vaccine, because that one's a 1 dose instead of a 2-dose vaccine. That way we don't interfere with students' summer plans.
Sheri, is there any evidence that the COVID vaccine affects our athletic performance?
No, we haven't seen anything where it indicates that the vaccine will have a negative impact on performance, except for the potential for the minor side effects that Dr. Marsh mentioned. But it would just be a matter of timing that we weren't receiving those doses right before we would expect to compete.
And I think it's important to note that if you do get COVID, it can affect your performance, and it can affect your performance for a long time, as we're seeing some student athletes have a little more difficult time returning to normal and fully recovering through their full participatory status. So I think that's an important point.
Or even if they don't contract it, just ending up on a contact trace list after being potentially exposed, that having the vaccine would help eliminate that process as well.
That's right. Dan, when should we get the vaccine? Is it important as far as the timing of our season, or do we know yet?
I would have to agree with Dr. Gibbs for sure. I think as soon as it becomes available right now with the information that we have, probably the sooner the better. The one thing that I would say that we've learned over the past year is that the landscape of the policies that we put in place at Texas A&M based on CDC guidance, based on SEC guidance, is constantly changing. And so the point being, we're not fully aware right now of what the long-term incentives will be of the vaccine. Right now, we know that individuals that are fully vaccinated is defined as having been at least 2 weeks since your final dose. And once individuals are fully vaccinated, right now, they don't have to participate in our surveillance testing that we've all become so fond of. And as Sheri alluded to, obviously the other benefit is that within the window of being fully vaccinated, again, 2 weeks after your last dose and 90 days, they're also exempt from contact tracing. Obviously, if somebody were to be exposed to a positive case and develop symptoms, we would need to test them as well, but they would not be automatically defined as a contact in that process.
But the question is going to be, do I have to wear a mask if I'm vaccinated?
I think Dr. Marsh and Dr. Gibbs kind of alluded to that already. Even if vaccinated, there's certainly a benefit to continuing to wear face coverings. And as of right now, Texas A&M University still has a face covering policy. And so at this point in time, it doesn't exempt us from the benefits of face covering for sure.
So Dr. Gibbs, from the SEC Medical Task Force, as a student athlete, will it be mandatory for us to be vaccinated prior to participation or prior to training or competing?
I would say that's highly unlikely. I'm not going to rule it out completely, but I'll say it's highly unlikely. So the vaccine right now is approved under an emergency use authorization. And what essentially that means is that it's gone through the FDA partial approval process, but hasn't come out on the final side. So essentially they've said that the benefits far outweigh the risks. So they want people to have it. So while it's under an emergency use authorization, it's extremely unlikely that it would be required. I think that it may be something that once it's fully approved through the FDA, it may be something that's discussed, and it may be something that does take place in fall or spring of next year.
With the rush to develop more vaccine, has there been any shortcuts to the safety of the vaccine, or is it perfectly safe for us to be vaccinated?
Well, one of the things that I would say is, remember, no shortcuts were taken when it came to development of this vaccine. And the vaccine technology that's being utilized has been around for quite some time. So while the messenger RNA technique is new to these particular vaccines, it's not a technique that's new. Now, when I say no shortcuts were taken, it was an accelerated timeline. So some items were done simultaneously. So I'm not going to bore you with the details of clinical trials. But they're essentially, when you're talking about a new drug, they're essentially a phase 0, a phase 1, a phase 2, and a phase 3 clinical trial. Because of the urgency needed for this vaccine, all of those trials were allowed to move forward simultaneously. Whereas normally they're done one stage at a time. The reason why they're normally done one stage at a time is these are extremely expensive to do. So for most pharmaceutical companies, if the drug doesn't meet your safety indicators in phase 0, you don't move on to phase 1, you don't move on to phase 2, and you don't move on to phase 3. So all of these have different safety indicators in them, and they're all looking for different outcomes associated with their efficacy and their safety. So what was allowed to happen in this one was, instead of them doing in sequence, some of those phases were allowed to overlap, which essentially reduced the timeline to get to the same clinical outcomes that you would do for any other new medication. Now, when we're talking about vaccine safety, these vaccines have been shown to be as safe as any other vaccine we have, and vaccines are inherently very safe. They're one of the safest medications that we put into our bodies.
Thank you. So Dan, would you kind of tell us in a wrap up, how can we get the vaccine? How do we access the vaccine the most effective way?
Yeah, fortunately, Dr. Gibbs covered this a little bit earlier too, but there are several ways to get it right here, right now. Our student health center here on campus, like he said, has doses that are available. Student athlete staff, basically anybody that has a UIN is able to get the Pfizer vaccine through the student health center currently. Through athletics, we've also kind of set up a couple of different vendors. Dr. Gibbs also alluded to the Brazos County Hub. If mom, dad, cousin, anybody else in the community wants to get a vaccine, that's the simplest way for them to sign up and be able to get an appointment within a short period of time. But through athletics, you can certainly get with your athletic trainer, email Sheri, email myself, email Doc. We can plug in with a couple of the vendors that we've set up to help give us a little bit inside access.
Well, thanks everyone. And I want to, express our appreciation to everyone who's watching this, who's educating themselves on vaccination, and appreciate the involvement of our expert panel. Again, we are always available for any questions, concerns, online, offline, whatever questions you guys may have in response to this panel or in response to your questions regarding the COVID vaccine. So appreciate you guys. And if any of you guys have any parting comments, please jump in, but otherwise we'll call it adjourned.
As always, we'd like to thank you for taking your time to download us and watch us, whether you're watching us on YouTube or you're listening to us on audio. We hope this has been great information for you. I know it's been great information for me, and I hope we can continue to arm ourselves with well-founded and accurate information as we all decide what to do next when it comes to COVID. We hope that you join us next time for an interesting person in the world of sports medicine and human performance. And until that time, we hope that you stay active and healthy.